Hey there, welcome back to our channel. Today, we're going to be talking about an important topic for pregnant women, preeclampsia. If you're not familiar with preeclampsia, it's a serious condition that can affect both you and your baby's health during pregnancy. So, let's dive in and learn more about what is preeclampsia. Preeclampsia is a pregnancy complication that usually develops after 20 weeks of gestation. It is characterized by high blood pressure and damage to organs, such as the liver and kidneys, and can also cause the placenta to separate from the uterus. Preeclampsia can lead to serious health problems for both the mother and baby if left untreated, and it can also be life-threatening in some cases. While anyone can develop preeclampsia during pregnancy, there are certain risk factors that increase the chances of developing the condition, such as being a first-time mother, having multiple pregnancies, being over 35 years old, having a family history of preeclampsia, and having pre-existing conditions such as high blood pressure, kidney disease, or diabetes. Early detection and treatment are important to prevent serious complications and protect the health of the mother and baby. Please like and subscribe to our channel and click bell icon to get more health updates. Who is at risk for preeclampsia? Understanding the factors that increase the chances of developing this pregnancy complication. While anyone can develop preeclampsia during pregnancy, there are certain risk factors that increase the chances of developing this condition. First-time mothers. One of the biggest risk factors for preeclampsia is being a first-time mother. Studies show that first-time mothers are more likely to develop preeclampsia than women who have had children before. This is because the immune system of first-time mothers may not be as well equipped to deal with the changes that occur during pregnancy. Multiple pregnancies. Another risk factor for preeclampsia is having multiple pregnancies. Women who are carrying twins, triplets, or more are at a higher risk of developing this complication. This is because the placenta needs to supply enough nutrients and oxygen to multiple fetuses, which can put more stress on the mother's body and increase the chances of developing preeclampsia. Age. Age is another important factor that increases the risk of developing preeclampsia. Women who are over 35 years old are more likely to develop this complication than younger women. This is because as women age, their blood vessels may become less flexible, which can make it more difficult for the body to adapt to the changes that occur during pregnancy. Medical history. Women who have a history of certain medical conditions are also at a higher risk of developing preeclampsia. For example, women who have high blood pressure, kidney disease, or diabetes before pregnancy are more likely to develop preeclampsia. Additionally, women who have had preeclampsia in a previous pregnancy are at a higher risk of developing it again in subsequent pregnancies. Family history. Finally, having a family history of preeclampsia can also increase the chances of developing this complication. If your mother, sister, or other close family member has had preeclampsia during pregnancy, you may be at a higher risk of developing it as well. Preeclampsia is a serious pregnancy complication that can affect anyone, but certain risk factors increase the chances of developing this condition. If you are pregnant and have one or more of these risk factors, it's important to work closely with your healthcare provider to monitor your health and manage any potential complications. By being aware of these risk factors and taking steps to manage them, you can help protect the health of you and your baby during pregnancy. Symptoms of preeclampsia. How to recognize the warning signs during pregnancy. Preeclampsia can be difficult to diagnose, as some of the symptoms can be easily mistaken for normal pregnancy symptoms. However, there are certain warning signs that you should be aware of. High blood pressure. One of the most common symptoms of preeclampsia is high blood pressure. Your healthcare provider will check your blood pressure at each prenatal visit, but if you notice that your blood pressure is consistently high, it could be a sign of preeclampsia. Normal blood pressure during pregnancy is typically around 120/80ths of a millimeter Hg. Swelling. Another common symptom of preeclampsia is swelling, particularly in the hands, feet, and face. While some swelling is normal during pregnancy, excessive swelling could be a sign of preeclampsia. If you notice that your rings or shoes are suddenly tighter, or if you develop sudden puffiness in your face, it's important to talk to your healthcare provider. Headaches. Headaches are another symptom of preeclampsia that should not be ignored. While headaches are common during pregnancy, preeclampsia headaches tend to be severe and persistent, and may not respond to typical headache remedies such as acetaminophen. Blurred vision. Blurred vision or seeing spots can be a warning sign of preeclampsia. This is because preeclampsia can affect blood flow to the eyes, which can cause vision changes. If you notice that your vision is suddenly blurry or if you see flashing lights or spots, it's important to contact your healthcare provider right away. Abdominal pain. Finally, abdominal pain can be a symptom of preeclampsia. This can be a sign of liver or kidney damage, which can occur as a result of preeclampsia. If you experience severe abdominal pain, particularly in the upper right quadrant of your abdomen, it's important to seek medical attention immediately. How is preeclampsia treated? Preeclampsia is a serious pregnancy complication that can develop rapidly and lead to life-threatening conditions for both the mother and the baby. Monitoring blood pressure. If you're diagnosed with preeclampsia, your healthcare provider will first monitor your blood pressure closely. This is because high blood pressure is one of the primary symptoms of preeclampsia, and can lead to complications such as seizures, stroke, or organ damage. Your healthcare provider may recommend bed rest or hospitalization in some cases, and will likely ask you to come in for frequent checkups. Medications. To manage your blood pressure, your healthcare provider may prescribe medications such as antihypertensives. These medications can help lower your blood pressure and reduce the risk of complications. However, it's important to follow your healthcare provider's instructions closely and avoid over-the-counter medications, as they can interact with prescription drugs and harm you or your baby. Delivery. If you're diagnosed with severe preeclampsia or HELLP syndrome, your healthcare provider may recommend delivery. This is because delivery is the only known cure for preeclampsia, and it's the best way to protect the health of you and your baby. However, if your baby is not yet fully developed, your healthcare provider may recommend medications to help your baby's lungs mature before delivery. Lifestyle changes. In addition to medication and delivery, lifestyle changes can also help manage preeclampsia. These changes may include reducing your salt intake, staying hydrated, and resting as much as possible. Additionally, your healthcare provider may recommend avoiding strenuous exercise and high-stress situations, as they can exacerbate your symptoms. In conclusion, preeclampsia is a serious condition that can affect anyone during pregnancy. If you're pregnant, it's important to be aware of the symptoms and risk factors, and to seek medical attention if you have any concerns. Remember, early detection and treatment can help prevent serious complications and keep you and your baby healthy. Thanks for watching, and don't forget to subscribe for more pregnancy-related content.